This is a PA chest projection. Patient is rotated to the left because the distance between the sternoclavicular joint to the vertebral body is greater on the left side. To correct this, rotate the patient body to the right side until the mid-sagittal plane is perpendicular to the IR. In this radiograph, there is no tilting because 2.5 cm of epiphysis is visualized above the clavicle. The lateral end of clavicle is elevated. This indicates that the patient's shoulder is not depressed. The edge of the scapula is retracted laterally and is outside of the lung field, which means that the patient's shoulder is pushed forward. The ninth posterior rib is visualized above the diaphragm, which indicating that there is no full aeration. The heart shadow is not enlarged because the cardiothoracic ratio is clearly well within the limit of 15%. The alignment between the X-ray tube and IR is correct because the collimation of 4 parts is equal distance. For X-ray tube and part, the alignment is not correct because it's not centered to T7. Therefore, adjust the X-ray tube superiorly until the center of collimation centered to the T7. Alignment between IR and part is not correct because the collimation is not centered to the centering point, which is at T7. Therefore, adjust erect Bucky until the collimation is centered to the T7. For collimation, the structure of the superior border, which is the epiphysis of lung, is included, and the structure of the lateral border, which is the lateral skin membrane, is also included. But inferior border, the structure of the inferior border, which is the costophrenic angle, is included. Therefore, the collimation is correct. For exposure, the thin and thick structure of bony cortical outline, which is the vascular lung marking, thoracic vertebra, and the posterior rib behind the heart is visualized. Hence, this means that the penetration is adequate. For the density, which is the thin and thick structure of the bony trabecular pattern, which is the air-filled trachea and the upper thoracic vertebra, is also visualized, which means that the density is adequate. Hence, there is no change in KBP and MAS. The anatomical marker is not presented on the radiograph.
Oh no!
It should be placed either on the upper right border or upper left border of the radiograph. The size of film used in this radiograph is 35 x 43 cm, which is suitable for this projection. This is because it can demonstrate all the structure of interest. And there is no evidence or artifact seen in the radiograph. Patient's name and ID, date of examination, place of examination is visible on the radiograph, but the placement is wrong because it's supposed to be at the top of the radiograph.